See important safety information and full prescribing information at the end of the video. Only your doctor can determine if this therapy is right for you.
Keep in mind that the pump is filled full of medicine, and the medicine is used up and then it has to be refilled. You come into the clinic and we use a template on top of your pump over your skin where we can figure out where the reservoir is. We insert a small needle, we suck out the old medicine, we squirt in new medicine and take the needle out. We reprogram the pump to let it know it's full and then you're done. And that whole procedure can take 5-10 minutes. When we put the medicine in the pump, it has to be refilled at the farthest reach every 6 months. If you use a lot of baclofen, it's like driving your car really hard or really fast. You're going to use it up quicker. And as a result, you're going to need to be refilled sooner. I would say that in our center, most people are refilled right around 3 to 6 months, depending on their baclofen usage. Long before we go to the operating room, it's important that the patient understands their own responsibilities when they have a pump implanted. If you choose not to have your pump refilled, that can be a very, very scary and dangerous event. And so it's critically important that patients understand their own responsibility. When you have intrathecal baclofen, if you let the pump run dry, you can go through a withdrawal syndrome. And it's a spectrum, and it goes from being a little itchy and stiff to maybe being in a coma or having a seizure. And we train our patients what to look for and how to address early signs and symptoms of withdrawal. Similarly, if the dose is too high, it can make you sleepy and groggy and floppy. And so we alert patients ahead of time so they know what to look for and they know how to respond.
ITB therapy with Leorosol intrathecal baclofen injection is a treatment that may relieve some of the symptoms of severe spasticity. People who have severe spasticity resulting from cerebral palsy, multiple sclerosis, stroke, brain injury, or spinal cord injury may be candidates for ITB therapy. When spasticity is due to spinal cord injury or multiple sclerosis, oral baclofen must not control spasticity adequately or have intolerable side effects. ITB therapy may be considered 1 year after a traumatic brain injury. Safety and effectiveness have not been established for children younger than 4 years old. When receiving ITB therapy, make sure you follow your clinician's instructions closely. A sudden stop in therapy can result in serious baclofen withdrawal symptoms, such as high fever, changed mental status, muscle stiffness, and in rare cases may result in the loss of function of many vital organs and death. It is critical that your clinician be called right away if you experience any of these symptoms. Make sure you keep your scheduled refill visits so you don't run out of medication, baclofen. You should also know the early symptoms of baclofen withdrawal. Some people are at more risk than others for baclofen withdrawal. Speak with your clinician about this. Seizures have been reported and can be associated with overdose, withdrawal, and maintenance therapy. A screening test will help show if you will respond to the intrathecal baclofen. You should not receive ITB therapy if you have an infection, are allergic to baclofen, or have a body too small for an implantable pump. Implanting the system has possible risks, including infection, spinal fluid leak, and headache. Pump or catheter problems can occur after implantation, which may require corrective surgery. Complications may cause a return of your spasticity symptoms or symptoms of overdose or withdrawal of intrathecal baclofen. An alarm should sound if there is a problem with the pump or if the pump needs to be replaced or filled with baclofen. Always inform healthcare personnel that you have an implanted infusion system before any medical or diagnostic procedure, such as MRI or diathermy. The most common drug-related side effects of ITB therapy include loose muscles, drowsiness, upset stomach, vomiting, headaches, and dizziness. Intrathecal baclofen may cause drowsiness. Use caution when driving, operating machinery, or performing other hazardous activities. Use of intrathecal baclofen with other depressants and alcohol may increase drowsiness. Titration is required to determine the best dose for treatment. You and all caregivers must receive adequate information regarding the importance of keeping scheduled refill visits and should be educated on the early symptoms of baclofen withdrawal and overdose. Not everyone responds to ITB therapy in the same way. To understand the benefits and risks of drug delivery therapy, please discuss them in detail with your physician. A prescription is required. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit fda.gov/medwatch or call 1-800-FDA-1088. The risk information provided here is not comprehensive. To learn more, talk about ITB therapy and Liorasol intrathecal baclofen injection with your doctor and refer to the FDA-approved product labeling. Please refer to the full prescribing information about ITB therapy accompanying this video. You may also visit Medtronic's website at spasticity.com/safety.